Hello, everybody. Welcome. Welcome to the Health Coaching and Trauma-Informed Care webinar. This will help you continue to grow and serve your participants while staying within the scope of your practice. By attending today, you will earn 1 continuing education credit approved by the National Board for Health and Wellness Coaching. Tomorrow, all attendees will get an email from Zoom that includes a link to a knowledge check quiz. Once you complete that, we will email you your continuing education certificate. We have a Q&A feature, and we will have some Q&A at the end today. Please use that to submit your questions, and also feel free to use the chat feature to connect with other attendees. Now, the following webinar will be discussing trauma and trauma-informed care. While we will not be addressing the trauma in detail, the subject matter could be triggering for those who have experienced trauma. So if at any point the content becomes too much, please feel free to step away. My name is Brittany Kowalski. I'm a nationally board certified health and wellness coach with Avedon Health. Avedon Health is a team of behavior change experts who are passionate about providing health strategies that empower people to make positive life changes. We focus on the individual, not just the condition, using innovative engagement technology, impactful courses and content, and care team support to help drive meaningful outcomes at scale. Our mission: to change lives by fixing the engagement problem in healthcare. Avedon Health is excited to feature one of its very own to bring you this phenomenal and much needed information. Please note this event is purely educational. It's not medical advice, and it does not reflect the views of Avedon Health. Now on to our expert, Tanya Haley. After a successful career in the airline industry, Tanya found her passion for health and wellness through a personal health crisis. Ms. Haley has a vested interest in changing the landscape of our healthcare industry through awareness, education, and implementation of trauma-informed care. She holds a master's degree in health promotion from the University of Delaware and is a certified health coach. In her spare time, she enjoys spending time with her 2 sons, teaching group fitness class, and being of service to those working towards overcoming adversity to live a long and healthy life. So everybody, let's give Tanya a warm virtual welcome.
Thank you so much, Brittany. I'm really excited to be here with all of you. And our plan today is really to spend some time going over the basics of health coaching and trauma-informed care. Now, for some of you, this might be a refresher, and for others of you, it might be your first introduction into trauma-informed care. So whatever your current knowledge level is, we do hope that you find this webinar to be beneficial on both a professional and personal level. And so before we get started, I'd love just to take a quick poll. And on a scale of 1 to 10, how do you currently feel your skills are and knowledge are for trauma-informed care? 1 being not very skilled or knowledgeable, and 10 is you're extremely skilled and knowledgeable on this topic.
Excellent. So the poll is launched and the feed is just flowing in. Keep it up. We'll give it about 10 more seconds for you all to put your votes in. 5, 4, 3, 2, 1. And here are our results.
Oh, wow. We do have a variety of different knowledge levels here today. So I'm really excited to see that, and just want to give you guys a big warm welcome. And with that, why don't we just go ahead and get started. You'll see here, this is our agenda for today. We'll start with going over trauma-informed care, including the tenets of trauma-informed care, our coaching considerations, as well as some resources to get you guys started. So in order to really understand the principles of trauma-informed care, we first really need to understand what trauma is. Now, currently, there are a ton of different definitions really out there that try to encompass what trauma is. So for today's purposes, I did pick 2 definitions that I find really encompass what trauma is. And this first one that we have, you'll see, is from the DSM-5, or the Diagnostic Statistical Manual for Mental Health Disorders. And they really say that trauma is this emotional response to distressing events. And they've listed abuse, accident, rape, sexual violence, combat, and other natural disasters. So we're looking at that emotional response to something that is considered traumatic. And then our second definition today, this comes from our Substance Abuse and Mental Health Services Administration. And this one I think is important to note because really, as they say here, individual trauma results from an event and also a series of events or a set of circumstances that have an overall lasting effect on an individual's physical, social, emotional, and spiritual well-being, really encompassing the idea that trauma affects more than just one level of a person's well-being. So those are those two definitions that we'll work with today to give you an idea and use as the base for what we're going on. So what really is important to know about trauma is that no two people will really experience trauma the same way. The way one experiences trauma and the lasting effects of trauma are really influenced by many factors, and they include the types, severity, and the duration of trauma. And we also take into consideration any protective factors and skills one may possess at the time of trauma and as they acquire through their lifespan. What we're going to learn here today, if you don't already know, is that what we have understanding is that there are lasting effects on one's overall health and well-being. And while trauma really can occur at any point in one's lifespan, I want to draw attention to this one landmark study that really began this concept into trauma-informed care. It really began to investigate trauma exposure and evaluate those health outcomes that were associated with exposure to trauma. So this brings us to our ACE study. ACE stands for Adverse Childhood Experiences. This study was originally conducted in Southern California during the mid-90s by a large managed healthcare company. What it was a 10-question questionnaire that was given to over 17,000 individuals that were seeking healthcare services. And it asked each individual to reflect back on their lives and then answer one of these 10 questions according to whether or not they experienced any one of these classified areas of trauma before the age of 18. So this is retrospective, they were looking back. Now we understand that with this questionnaire, for each exposure they might have had, they were to give themselves a score of 1, with a total score being up to 10. So if you were exposed to a trauma, you'd give yourself 1. If there was multiple traumas, you would give yourself a 1 for each one, coming up with a cumulative score. What we found in this study was that the higher the score, the greater risk in engaging in negative health risk behaviors. And we continued to learn that not only was negative health risk behaviors associated with trauma, we are also seeing that there is a biochemical change in the body and the brain as it results to early childhood adversity. And what this basically means is that higher the score, the more likely or the greater risk you are for these negative health outcomes later in life, including chronic disease states and shortened lifespans. So what we understand about this ACE study was it was very instrumental in the inception of trauma-informed care. This is kind of where it started. But we did realize that there were some limitations to this original study, and that included a lack of diversity. So the population of this particular study was mainly Caucasian, middle class, who were insured and seeking medical health care. So these limitations actually prompted a whole another set of studies to really evaluate and fill those gaps. And one of those studies included our Philadelphia ACE project. And what they studied was those gaps that they found to be in that lack of diversity, which led to the inclusion of 5 additional categories of trauma. So to give you a better idea of what that looked like, we'll look here. So on the inside, you'll see the original 10 areas of classified trauma from this ACE study. These areas included abuse, neglect, and household dysfunction. Abuse was categorized as physical, emotional, and sexual. Neglect had 2 categories of emotional and physical, And our third category consisted of household dysfunction, divorce and separation, domestic or household violence, mental health issues, substance misuse, and parental or caregiver incarceration. So these were all of the original 10, and as the questionnaire established, you were to give yourself a score of 1 for any one of these 10 items, and then to accumulate. So the later studies, we did expand on this particular origination, and there are 5 additional categories you'll see on the outside. We have the community violence, neighborhood safety, racism, bullying, and living in foster care. So you might be wondering why this is so important to us at this time. We have known, studies have already shown us now that there's a cause and effect relationship between early childhood adversity and trauma across the lifespan. We know that it is associated with negative health outcomes. So what we know is that trauma is way more prevalent than one originally thought, and that approximately 61% of adults have experienced at least one ACE score. Originally, before the original ACE study, there was this association where trauma was generally associated with small pockets of areas and different racial and ethnic groups. But as we learned in the ACE study, it was mainly Caucasian, and there still was a high prevalency of trauma. So it was something to really consider, that it's way more prevalent than originally thought. We do know that 1 in 6 adults experience 4 or more types of ACE. And this is something really important to note. 4 became the number that really increased your risk for negative health outcomes and later life health issues. And also to note is that females, racial, and ethnic groups were at greater risk for 4 or more ACE-related events. So what does that mean? So those with an ACE score of 4 or more were 3 times more likely to develop depression. They were 2 times more likely to develop heart disease, and 4 times more likely to develop serious issues with alcohol. Now, this is just for an exposure in general. There's one thing to really consider as we look at trauma exposure and how it affects somebody, is we really have to take in effect to the dose response, or how much trauma they've been exposed to and what that means for their risk factors. So we think about the accumulative response to trauma. So we know that if someone experienced one traumatic event, it's shortened, it's in a very isolated situation, their dose response is going to be much lower. We do know that if someone is experiencing chronic trauma or chronic toxic stress, such as domestically violent households or chronic abuse of some nature, community violence, things like that, this is going to accumulate over time, creating a higher dose response, meaning their response to trauma might be greater than, say, someone who experienced something in an isolated incident. And as I said before, no people will experience trauma the same. So it's really important to note that this is going to be an overview of what trauma can do, and that each individual person will experience it in one way or another, depending on so many factors. So we know that there's an association between trauma and health outcomes. And so it's like, great, we know this. Where do we go from here? So what I'd like to do is look at some of these potential negative health outcomes associated with trauma and early childhood experiences. So with that being said, I'd love for you guys just to take a moment and in the chat, go ahead and start jotting down some of those potential negative health outcomes that you know or might think are associated with some exposure to trauma. Right, absolutely. Oh, look at them all come in. I can't even keep up with it all.
Right, I can't read quick enough, but a lot depression, anxiety, obesity, addiction, substance misuse.
Exactly.
Keep them coming, everybody. Keep them coming.
So let's go ahead and take a little bit look on what that looks like. And you're absolutely right. A lot of you are nailing it completely. We have 3 different categories that we really focus on. And that is the physical, mental, and behavioral side of trauma and how that affects what's going on with somebody. And so on that physical side, you'll see a lot of you listed this, and actually I'm seeing a lot more listings than what's listed here: fibromyalgia, chronic fatigue syndrome, inflammation issues, things like that. But we really do see an increase, like I said, in heart disease, stroke, respiratory disease, cancer, diabetes, obesity, and really the possibility of early death. So like you said, some of you are in there, way more that is associated. These are some of the top ones we really think of, but you're right, there's so many more physical health issues that are associated with the greater risk for trauma exposure. So then we look on that mental health side of things. And like you said, we have depression, anxiety, and then trauma and stress-related disorders such as PTSD and complex PTSD. And then looking over in our behavioral side of things, just like you listed, risky sexual behavior, which includes early initiation of sexual activity, substance misuse, addiction issues, financial issues, as well as interpersonal relationships, poor self-regulation, and difficulty with impulse control. So while we're looking really today at how trauma impacts an individual and how that impacts your interaction with that individual, there's one thing really to take note about the exposure to trauma and the greater risk for health outcomes is that it's not just an individual issue. It is associated with a burden on some of our society's costs, such as an increased utilization of healthcare and social services. It is showing that we have that individuals with an ACE score of 4 or more utilize these services at a much greater rate than those with less than 4, and that they are using all of our healthcare systems and not always in the way that gets them the kind of treatment and services that they need, really causing a burden on that healthcare dollar. We're spending more per person. So while that's something to consider, we're going to focus on the individual. All right, so that's what brings us why we're all here, right? We want to know, what does this mean? What is trauma-informed care, and how do I use it? What does that look like? So that's what we're going to go over now. So we just had that very overview look on explaining what trauma is and what that kind of outcome is for someone who experiences trauma. So trauma-informed care is really an approach or ideal in which survivors of trauma are able to access and utilize healthcare services without the potential to be re-traumatized. It is the basic understanding of how prevalent trauma is and how the impact it can have on one's physical, emotional well-being and mental well-being. The idea of trauma-informed care really is this concept and idea of being able to adapt our current healthcare system as it is to the unique vulnerabilities of this population, knowing that there's a large portion of our society that has experienced some form of trauma. So it's not like we're picking a 1% and saying we need to help this 1%. There's a much greater percentage that has been at risk, and some of the most recent figures are 16 to 20% of the population have experienced 4 or more ACEs. So really it's prevalent, and the idea is, how do we serve our population as a whole, making sure that they have a safe environment to be treated for whatever that is that they're seeking treatment for. So in order to understand trauma-informed care, we really want to get an idea of what are the tenets associated with trauma-informed care. And so what you'll see is we have 6 tenets that we use to kind of focus on trauma-informed care and how we interact with those that might be, survivors of trauma. I will note here that some areas you'll see 5 principles or 5 tenets instead of 6. And what it is a lot of times they will lump our safety, trustworthiness, and transparency into one tenet. Here we use it as into 2 separate tenets. So it's almost like looking at a clock. We're going to start here with safety as that first one, moving on to that trustworthy, transparency, support, collaboration, mutuality, empowerment and choice, and then cultural and historical and gender issues. So what I'd like to do is just break this down by each tenet, give an idea of what this looks like and how it can apply to you as a health coach or in a healthcare provider setting, okay? All right. So safety. Now, safety we think of in two really core areas. And that first one is that physical space or location. Now, granted, in the world we have today, we do have this idea of virtual and in person. So we have to think about space in two different areas now, whether it's a virtual space or an in-person space. So thinking about in person, the safety comes down to many factors in the sense that wherever they're seeking treatment is a safe environment. Can they go there? Is the environment in which they go into, is that also a safe environment? Are the people they interact with safe? Is that location, just providing them with the feeling that they can be there and not have to worry about their health and well-being? And some of this comes down to the simplest little things, such as the way that you might rearrange your office or your waiting room, right? Someone who's experienced trauma, especially those with a higher ACE score, may not want to have their back to the door. And so if that chair is facing with their back to the door, that might be very re-traumatizing to them or putting them in a situation or feeling where they may no longer feel safe. So really think about that when you're designing your space. What does that look like for someone who might experience trauma? We also look at the idea of personal interactions. And this really comes down to you, your staff, anybody that might be having that front end facing interaction. Are they providing a safe and warm and welcoming environment? Or are they, coming at it as a little bit more clinical and less inviting, right? Sometimes when you get too clinical, it can be very off-putting to those that have some issues with trauma exposure, and those kind of interactions where authority figures or those deemed to considered authority might be a little bit more off-putting for them. So really creating that warm environment. So then we look at the trustworthiness and transparency, and we think about this in three different areas, right? And this is where health coaching already takes this into consideration, right? We have the aim to build trust with our participant. We call this rapport building. And it's really establishing that line of communication that puts the two of you together as a team, creating this environment where they're able to trust you and establish this kind of connection that they need in order to get the care that they need. We also want to make sure that there's a clear understanding of policies and procedures. And this can be something as simple as having multiple different avenues and access to printed policies and procedures for late appointments, how to make appointments, how to contact people, and again, many different avenues, whether it's online, in person, on paper. How do we get this so they have a clear understanding of these connections or of these policies and procedures? And also that continuity and consistency of care. This is extremely important, and the idea that in order for someone to have trust and comfort and be able to put their trust in you as their care provider, we need to provide them with the idea that we are consistent and we are providing the same kind of care each and every visit. We're going to show up on time, just like we ask of them. We're going to provide them with the tools and skills that they need to be there, and we're going to make sure that we're there to help, right? It's always about that consistency and continuity. If you're canceling left and right, or they're getting rescheduled by a facility, that's going to cause this distress and be a little bit more traumatizing. So we like to look at that continuity and consistency. All right, moving right along. We all know that support is extremely important. I mean, studies show that just the idea of having a connection, that you have that social support, can reduce your incidences of depression and anxiety. So that same thing comes here. And what does that look like for us as caregivers to someone who might be experiencing trauma? That might be helping them identify where their support areas are, right? So we look in two different main categories. And that one's really going to be those personal connections, whether it's going to be family, friends, coworkers. What are those personal connections that they do have that help them maintain and get the support that they need on that interpersonal level. And then we also look at the idea of a community, right? And this comes in so many different ways. We look at those direct community connections. You also look at healthcare settings, churches, social groups, whatever it is that gives them the opportunity to feel connected and have an idea that they have a place to go should they need that support. And of course, never ever discount the fact that there are a lot of local and national support groups and systems out there available to anybody, whether it's the idea of a 12-step program or a faith-based organization or just something that is supported on these new apps like Meetup, right? Looking for those avenues that provide them with the support that they're looking for. All right. We also look at collaboration and mutuality. And this is something that's extremely important and already kind of a part of the health coaching practice, right? We're looking to collaborate with our participants, our clients. We're looking to put them in the driver's seat, give them the power to take control of their own personal health, and really give them that autonomy, right? Well, there's two things we really need to think about when we're thinking about this particular area. And that first one is really important. And this is the leveling of any power differentials. And this can be a simple setup of, like I had explained earlier, the way that you set up a room, right? Eliminating the need to feel like while you might be the expert, you don't have to necessarily come across as that being superior than they are. So think about if you're setting up an office, do you have a seating area that you can sit at as opposed to you behind a desk and them on their other side of the chair? Is it like when you go into an exam room, is it having your patients sit on a chair and you sit on a chair and discuss things before you invite them to the exam table? And then with health coaching as well, we think about really the idea of letting them know that we're a guide. We're here to help in this process. And we know that it takes both of us to get where they want to go, right? They want to make the choices. They have to have the autonomy. And we're going to be here to help guide and provide them with the tools that they need to get there. And then, of course, my favorite one, which is part of health coaching. We do this all the time. Sharing of power and decision-making, right? We're always giving our clients choices. And that's what takes us outside of some of our traditional ideas of healthcare, where the doctor was the superior and you followed the directions of the doctor, right? The idea of giving someone some power in their decision-making process really does give them a sense that they have some control in the situation. And that could be something as simple as giving them two choices to make between. Now, we may not always like our choices, but at least having the ability to make a choice is going to give someone who've experienced trauma the idea that they do have some say in what's going on, and that they are of their own will to make these choices. So really that sharing of power decision making. We do this all the time in health coaching. So I don't think I have to go too much more into that. All right. So now we look at this empowerment and choice, right? This sets up from our last one. And you notice that a lot of these tenets really do stack on top of each other and maybe even overlap a little bit, but it's the whole concept and idea of how we approach an individual. So we do have that shared decision making, right? Setting an agenda with a client, giving them the opportunity to choose what that looks like for them. We have the idea of giving them choices, like I said before. But the last one that we look at is this kind of goal setting, which we work on all the time, this plan of action, right? Not only are you here to support them in their desire for change or lack of desire for change, you're trying to give them the tools that they need to get where they want to go. And this is something that we work on all the time with health coaching by setting something as simple as a SMART goal, right? Making something very specific, measurable, attainable, time sensitive, right? Looking at what can they do to take control of their own decision-making power. And then our last one that we like to talk about is are cultural, historical, and gender issues. And this is something that's really important to kind of note. This can go in two different ways. One, we can use the cultural, historical, and gender issues to our benefit to help facilitate movement through the stages of change, movement of change. But it also can help us understand why we might be hitting some resistance or what might be associated with some other trauma experience. And when we look at that kind of cultural side of things, we're going to look at, how does a cultural interact with each other and what does that mean to them? We see all kinds of trainings now about cultural competency and cultural intelligence, making sure we understand. And I'll give you one little example of a client I had who was of Indian descent, and it was a certain high holiday, and the family was getting ready for that high holiday. This client had been working on, getting a bit healthier, making some lifestyle changes, including some dietary changes. But with a high holiday, it was not in line with their particular goals. And so we had to take into consideration where could they make some modifications and still stick with their cultural beliefs and participate in their high holiday. So that was something that was really it was a little challenging, but it was really also very fun to kind of get an idea of what that means for that particular person or individual. We also like to look at the multi-generational aspect of this and how this can impact somebody. And we see this a lot from the past exposure, such as the Holocaust, and how that generational of trauma has gone down from each family as we've gotten farther away, and what that looks like and what that means. I mean, the closer you were to maybe someone who was a survivor of the Holocaust, there's going to be a different way that their families interact. So it's really kind of an idea of this multi-generational. Same thing when we think about, unfortunately, child abuse, right? It's very generational in the sense that it usually gets passed down and is repeated over and over again until someone decides to break that cycle. So what does that look like generationally? And then our gender differences, unfortunately, we still see that there are some gender differences in the way in our healthcare system. Women still experience some difference of treatment based upon their gender. And then we have to take into account that we do have the idea of gender fluidity, different gender identifications, and how traditional healthcare settings might not address the issues associated with those particular gender issues. So it's really something to be cognizant of. And I'll just share with you real quickly on that. I did have a transgender client, male to female, so that did pose some challenges on some of our goals, but it also gave a greater insight to why some of the obstacles that we were facing, right? So really understanding what those gender differences might come into play when you're working with your clients. And you may not know any of this all above, but some of the stuff might come out in conversation. And it's really important that you're able to identify these things when they do come out in conversations. All right. I know a lot of information. We're moving right along. So now I'd like to go ahead and talk about what are the 4 R's of trauma-informed care. And this is one of the easiest ways to kind of understand trauma-informed care at the simplest level. So that first R is what we're going to look at is really that realize. We are going to realize the widespread nature of trauma exposure. We're going to understand that it's not limited to certain ethnic groups. We're going to understand that it's not isolated. We're going to understand that trauma is something that is out there. And more than likely, you're going to interact with someone who has experienced trauma, some at very low levels and some at very high levels. But being able to identify that this is an issue is going to be really important in your practices and your success with your clients. And then we want to be able to recognize. Now, we went over some of the signs and symptoms, right? We went over some of the health outcomes of trauma. So if someone is having some, physical health issues, diabetes, obesity, if someone is experiencing some mental health issues, or you're knowing that there's some behavioral issues that might be associated with these early childhood experiences or trauma, being able to recognize the signs and symptoms, right? Those are the ones that we see and we talk about. How about the ones that we don't necessarily see? written as much. And this might be something as simple as you have a client that is teary-eyed every time they have a conversation with you because they can't, because everything is very emotional. That's a sign or symptom that they might be dealing with something a little bit more than just what they've come to you for. Another sign and symptom might be resistance, right? We're taught to roll with resistance all the time, but what we might not understand is why they have this resistance, right? So let's say someone is obese and they're pre-diabetic and their doctor's telling them they need to lose weight, and they come to you to lose weight, but yet they know what they need to do, but they're unable to make these changes. Why are they so resistant? Well, maybe food was their coping mechanism that got them through some trauma. And that it's going to be a little bit harder to put that down. So just being able to understand that it's not just, heart disease, obesity, depression, anxiety, that some of their behaviors and some of the way that they may interact is a sign that they might be someone who experienced trauma. And take into consideration, like I said, no one experiences trauma the same way. Same thing comes true for those that are going through the trauma experience. Some people have realized their trauma exposure and are working with it, and other people may not be there yet. So it's really just taking that idea to recognize what that might look like for your client. And this is what we want to know now. Now that we know trauma exists, now that we know what it looks like, what do we do? Respond. And the most important thing that you can do as a response to trauma really is never shame, blame, or punish your client. Our old medical design did tend to do that a little bit more than it does now, and it's really working on and giving them the ability to understand that they're human, the ability to understand that they have choice, and what that choice looks like for them. Okay. So really avoiding those kind of shame, blame, punishing behavior, and respond in a way that is appropriate for the client. And that might be matching that energy level a little bit, or bringing your energy level down just a little bit. If someone discloses something very traumatic, you don't want to be the cheerleader like, it's okay. You want to make sure that you bring that level down a little bit and show that understanding, that empathy, even if you don't have firsthand experience, being able to empathize with them and what they're going through and taking those next steps, whatever that might look like. And then this last one is really, really important, and this is to resist. And this is to resist re-traumatizing situations. This ties into that shame, blame, punishing behavior. This ties into putting them in a situation where they might feel unsafe, or putting them in a situation, even through some of your conversations, that might trigger, right? So we're looking at ways to make sure that we limit this idea of re-traumatizing our clients. Okay. So we've talked a lot about some heavy stuff. So what I'd like to do real quickly is just take a moment and in the chat, just put one thing that you are grateful for in this moment. I'm going to go ahead and start. I've thought about this, like, wow, what am I grateful for? I can say the very cliche things. I'm grateful for my children. But honestly, right now in this moment, I am so grateful for my opportunity to share this information with you all today, because it is so important to me. And it's so important to me in the sense that hopefully you'll take something home from this, and it's a trickle down effect. What does this look like moving forward? So I'm just grateful that you guys came here today, and I'm just really grateful for the opportunity I have. And
we have some really, great comments coming in, great things that we're all grateful for. Abundant life, the sunshine in the Midwest. Can I go there?
I'm so grateful for spring. I'm with you. I'm with you. The warmer weather. I'm so ready.
Yes. Other people commenting, grateful for their clients, families improving health, having a role where their job is supported by continuing education, nature time, babysitters. Heck yes.
Would not have got through life without a good babysitter.
Absolutely. Technology. Yeah, keep going. Everybody keep putting stuff in the chat. This is great. And then Tanya, of course. Reel it in.
I'm reeling it in. We're moving right along. So what we want to know is, what does this mean for us as our coach, as health coaches? What should we be taking into consideration? And the first thing I want to point out, really, and this is an important one, is our scope of practice, right? One thing we really want to understand here is that while we are now considered, you might be more trauma informed, aware now, right? It doesn't mean that you're skilled enough to deal with trauma directly. And this is something that's really important to note. You are not skilled to deal with trauma directly unless you have received additional training and certifications. So as a health coach, you can be aware of what trauma is and how it impacts your client, but we want to avoid trying to tackle the trauma head on ourselves, okay? So that means referring out, right? When do we refer out? What do we refer out to? So when someone's experienced trauma, there's going to be some mental health association. So we're usually going to recommend that they might seek some additional support through a licensed counselor or social worker. There's so many different ones out there. What I would like you guys to take away from this is that no two therapists are the same either. And that there are therapists out there that are trained and do extra certifications and hours on specific trauma treatments and techniques. So if you have someone that's experienced a high level of trauma, if you are helping them out with referrals, you may want to look for someone that is trained in trauma. And one thing to note is that just like with a health coach or any other care professional, not everybody's going to fit the same one. So sometimes we might have to try a few, and that's okay. Just really making sure that your client is there and understands. So referring out, one of the hardest things we have to do, right? So when we think about referring out, there's two things I'd like you to think about. When you're dealing with someone with trauma, what we would like to avoid doing is referring them out in a way where they feel like we're passing the buck. You're too much for me, I'm going to give you to somebody else. Because that could be very re-traumatizing. And then also too, what you want to think about when you refer out is bringing in a professional to help on that end with the work that you're already doing, right? Work in conjunction. They can do that trauma work on one side, and you guys can still work on those health behavior changes, right? So what does this look like? This might be saying something along the lines like, have you ever considered seeking some additional support from a licensed professional that is trained in this area? I wouldn't want to do a disservice to you. I want to make sure that you have you get the best care that you can get. Let me do that with you. Let's see how we can work together. Really letting them know that you're not passing them off and that you're learning, that you are referring them out with the most support you can provide them, knowing that it's for their best interest and not, a disservice, okay? Awesome. All right, so one way for you guys to identify what trauma-informed care looks like for you and your individual practices, whatever that looks like, this trauma-informed care pyramid is one of the easiest way to do this. And as health coaching, a lot of this is gonna overlap with what's in this pyramid. Patient-centered communication skills, motivational interviewing, using language they understand. What does it look like to be how you're communicating with this particular patient, making sure it's patient-centered, client-centered, participant-centered, whatever word you use, making sure it's geared for that particular individual. And you'll notice with each individual client, you may have to change your language to suit that particular client, and that's okay. So that second tier is understanding trauma. Look, you came here today. You guys got an idea what trauma is. Awesome. This is one step in your journey. And I hope you guys continue this step, but really understanding the health effects of trauma. Collaboration and understanding your role, right? Scope of practice. How do you guys work together? What does it look like? What does your role look like? And maybe that's what you go home with today, is taking a moment to understand what your role is moving forward, understanding that trauma is widespread. This one is really important to me, and this is understanding your own personal history. And, as I said, trauma is widespread, so you may have your own personal history. And I'm going to share one particular example. I was working with a client and we weren't quite communicating on the same level. I don't think I was taking into enough consideration some of the cultural and religious views on a particular thing. And as we're trying to navigate, and I just wasn't quite navigating, I was struggling just a little bit with this particular client, but they came back at me in a way that just immediately triggered something from my past. And it was one of those things where I had to take myself out of the situation for two reasons. One, the client was not getting the best coach for them, right? I needed to find a different coach that was able to give this client what they deserve to have in their coaching experience. And that turned out not to be me. That was a hard call, right? Knowing that you can't be the one for it. Because that client deserved the best. But I also understood that I had to take myself out because I don't need to be re-triggered every time I have a conversation or dread meeting with this particular client. And it was really just trying to address both people's needs, right? Understanding that, you know, you might have your own history, and understanding that they have their history. And sometimes we have to look at what that looks like, and it may not be you, and that's okay. And that goes to finding another available person that might be a good resource. And then screening, right? We do have screening tools available. They're out there, especially when it comes to the ACE questionnaire. You may or may not use them in your practices. If you do, make sure that you're fully trained in using these screening tools and know what your next steps are should you discover anything. Really it comes down to, you know, they're available, but it does depend on the type of practice you have and what that looks like. So, the last thing I want to really talk about before we drive this home is that protective factors. I've mentioned it briefly at the beginning. These are extremely important when dealing with someone who has experienced trauma, especially at high levels. Things that help someone deal with trauma better or even learn how to overcome their trauma is really that sense of social and community support. Support is huge. We know this. Identifying what are their connections, how they're tied to their community, and their personal sense of belonging. And then skill building. This is something we practice every day in health coaching. We're always teaching our clients how to build skills off what they already know. And so we look at those things like problem solving, helping them increase self-regulation with, you know, maybe stress management techniques. We're always looking at building their self-efficacy through small behavior changes and building on that. But the most important thing here is we're looking at resilience. How can we build resilience in our clients that have experienced trauma through our health coaching practices? And it's really tying all of this together into one pretty package to really kind of drive home that this is what it looks like. And in essence of time, we have a couple of resources. If your client is experiencing a health crisis, what do? We call 911, right? We need to make sure that if it's a health crisis that you call 911. We do have some resources here for national, which also has local resources for emergency services, suicide prevention, emergency services for maybe addiction issues, things like that. And then if you want to learn a little bit more, there are a couple of resources that you can always go online. Prevent Child Abuse America, they have great information on ACEs, and so does the National Child Traumatic Stress Network. If you really want to see something interesting, it's an old TED Talk now, but Dr. Nadine Burke-Harris, she did a TED Talk on ACEs and the outcomes of that. And so with that, she really has a great insight and a great way of explaining this. And then mental health first aid, we personally do it at our company. It's a great way to identify some potential mental health issues and what our steps are to take that next step. And that's a great addition to any health coach, is to really go through something like mental health first aid. And then of course, trauma-informed care is everywhere now. There are so many different certifications at local universities, online. If you are interested in getting certified in a trauma-informed care practice, that's something a little different. You would take these additional courses. So with that being said, I just want to say thank you guys so much. I'm so happy that you all came here today.
Awesome, Tanya. That was a lot of really useful information for health and wellness coaches. This was just very nicely put together. Thank you so much for your time. We are getting some questions. Once again, if anybody has questions, please put it in the Q&A feature here on Zoom. We're going to look at some of these and answer a few. So first one I see here is, what are the next steps if I suspect trauma is impacting my client?
Right. So that's a good question. We think about it in two ways. First off, is this an emergency situation? If they're experiencing some symptoms and signs of trauma and it's an emergency, please seek emergency services, 911, suicide prevention hotlines, whatever it is. If it's an emergency, we want to seek that first. Now, if you have an assumption that some of your clients are experiencing trauma, first and foremost, you need to make sure that you're in line with your company's policies and procedures. So if you don't have any policies and procedures, you might want to look into something like that, but really looking at what are your next steps through your company. If you're an individual practice, what do you have in place? But really what you want to be able to do is make sure you're matching your client at their level, staying in that scope of practice, and if necessary, helping them by referring them out to a professional to bring back in and work together to help them get where they need to be. But really, it's going to be individually based and really making sure that you focus on what is in your scope of practice and what your company policies and procedures might be in this area.
Well said. Yes, very, very, very important. More and more questions are coming in here. I have, what is the difference between trauma-informed care and trauma-informed approach?
So those really, it's two titles, and a lot of times they're just really used interchangeably. Trauma-informed care is the ideal. Trauma-informed approach is coming at that same kind of concept. You'll see them used interchangeably depending on where you're at. I don't think there's a huge difference to really note here under just that it's kind of an interchangeable term. They are moving from approach to care more as time goes by. So I think you'll see approach kind of drop off a little bit more.
Good point. There's two questions I think we can almost combine into one here. One is just examples of other experiences with a client who you discovered might be responding as a result of trauma, and if so, like what you did, because there may be that instance when you recognize trauma in a client, but they don't even recognize it. They don't know that they've experienced it.
Yeah, and that is going to be one of the more challenging clients that you might have to do, right? Because you don't want to re-traumatize them by bringing that up like, hey, I think you've experienced trauma. So it's more about finding safe ways to stay in that scope of practice, work on very superficial levels for some things, but then throughout your conversations, be able to bring in the idea of like, let's see, how could I word this? I'm thinking of one particular client in my head and how I worked with this particular client. And it was basically in this way of asking the client to provide you with some additional information that pertains to your topic, but tends to bring in a little bit and then becomes a self-discovery on their own and where they can kind of identify. But you never want to basically call out a participant, a client, and say, hey, I think you've experienced trauma. You can very supportively say, have we ever considered seeking maybe some professional assistance with a licensed care provider before? Have you ever done that? Is that something you'd be willing to explore? Really giving them the opportunity to explore it and not telling them this is what you think, if that makes sense.
Absolutely. Yeah, you want to tread lightly for sure. Like you said, you don't want to re-trigger somebody. So there was another thing you mentioned too, which somebody's pulling up or input here. It's that difference of, you talked about PTSD and complex PTSD. Can you go a little bit into what is complex PTSD?
Yeah, so complex PTSD is actually a newer term and isn't technically in the DSM-5 right now. They are trying to get it into the new version. But what it is you think about post-traumatic stress disorder, we thought about it as a very, isolated or specific event, war veterans coming back, then having PTSD from their experiences in the war. What we're understanding now is that there's multiple layers to trauma and there's multiple layers to post-traumatic stress disorder. Someone who's experienced many different areas of trauma and over an extended period of time, that's going to create more of an environment where we're stacking more trauma on top of each other, and it just becomes much more complex. You're not just dealing with one isolated incident or one area of trauma. There is so much more. And we think about this in children that are growing up in, environments that are unsafe, such as, unsafe neighborhoods with gang violence, maybe domestically violent households, members of the family that are misusing drugs and alcohol, things like that. And you start stacking them all up and you're creating an environment, and especially if it's extended period of time. So let's say someone experiences some sort of abuse and it's a one-time incident. That's just one incident, but if you're experiencing it in a repeated offender, then you're going to have a more complex idea of what that trauma is.
Absolutely. Here's another really interesting question. By asking if a client would consider seeking more specialized therapy, aren't you inadvertently diagnosing? And I have a thought on this, but I want to get your hunch too.
No, I don't think you're inadvertently diagnosing at all, because you're not diagnosing, you're simply having them explore another avenue, right?
Yeah.
And it could be, and I've even mentioned with this one particular client that I was thinking of, have you mentioned this before to your primary care physician or other licensed care provider, right? Is this something that you've talked about? So I'm not telling them you have mental health issues and you need to seek therapy. I'm just letting them know that, like, hey, have you explored other options? What does this look like? Is this something that might be beneficial?
Absolutely. And one last question today, and I love this question. I feel like it could go a lot of different ways too. And it's, how do you handle distinguishing catastrophizing versus a traumatic situation, right? So those cognitive distortions, so to speak, how do we handle differentiating between the two?
Wow, that is a really good question.
Right?
Question. Without sounding too cliche, this is very much going to be client dependent, right? You're going to understand that some of your clients might be creating or have a cognitive distortion of an event versus the actual reality. But guess what? It doesn't matter what's real and what's their distortion. What matters is how they perceive something and how you work with them. So that's really, I guess, the most important thing to understand is, even if you realize that this might not be as bad as you think it is, guess what? To them, it's bad. And that's what we want to make sure that we understand.
Absolutely. Absolutely. One final question, because this is a really good question. If I know a lot of health coaches like to work in specific populations. And so if a coach wanted to work specifically with a trauma-specific population, what should be that coach's next step to make sure that they can support people in that realm?
So there are a lot of new programs out there that are providing healthcare providers with trauma certifications. And it is usually, I think the one that I personally was looking at was a year or two program. It was accelerated, so maybe it was just a year, with a lot of additional hours and training to help them deal with trauma-specific patients. So, like, let's say you go and you become a licensed clinical social worker, right? You take these kind of courses, they train you in these kind of things. There are certificates out there available now, so you don't necessarily have to become a licensed clinical social worker. There are trauma-informed care certificates available. You're just going to have to look at what's available either nationally or locally for you.
Very good. Thank you so much. I mean, Tanya, thank you. I see the comments coming in. Everybody is so appreciative. And so let's talk about next steps. I want to be cognizant of everybody's time here. So once again, you will get an email from Zoom tomorrow, and in that email will be the link to the knowledge check quiz that you will have until 9 a.m. Eastern Standard Time, March 21st. Once again, 9 a.m. Eastern Standard Time, March 21st, to complete the knowledge check quiz. Don't forget to check your spam folder, just in case it goes in there. It'll be from Zoom. But once you complete that, we'll email you your continuing education certificate within the next week. Another question a lot of people had is, can I get a copy of the recording? You can register for Avedon Health's newsletter, where we will be publishing the recording in our next newsletter. I just put the link in the chat feature here for you. I'll also include that link in the same email tomorrow that will be coming from Zoom. With that, thank you all for joining us, and we hope you have a fantastic rest of your day. Be well.
Thank you.